of qualified organizations, to be followed by Davis Bean and Lou Kriegler. I'll have to Kreger of Affordable Housing First. Ryan Chandler, you're recognized.
Thank you. Good afternoon, Senator Yarborough and Representative Black. Thank you for the opportunity to speak with you today. My name is Ryan Chandler, and I'm the chair of the Association of Qualified Organizations. We provide waiver support coordination services to individuals with developmental disabilities. I wanted to thank you for your support of the APD iBudget waiver and waiver support coordination last session. I am here today because the future of the iBudget waiver, which has supported this vulnerable population in Florida for more than 30 years, is at risk. There are proposals to move the waiver program to a managed care system. On paper, managed care may sound efficient and may work for some individuals with less complex needs, but our population has diverse and complicated needs that cannot be fit into a managed care box. The devastating effects of managed care for this population with regard to dental and applied behavior analysis services is currently being experienced and should not be the only option for this population's daily services that they rely on to safely function in the community and at home. As waiver support coordinators, we don't just connect people with these services. We know our consumers personally for years and sometimes decades. We guide families through the Medicaid redetermination process, SSI and SSDI, SNAP, and all other vital third-party benefits. We connect them to community resources. We are a consistent point of contact in a complicated system. We have no incentive to delay, deny, or reduce services, referred to as the achieved savings rebate in the managed care model, which is currently 7.5%. We are paid the same regardless of the services the individual receives, so we have no bias in advocating for the best interests of the clients we serve. There is also a risk of continuity of medical care for these individuals with complex needs. Under the managed care model, clients are required to use doctors aligned with the managed care company's network. This means family may not have access to long-time doctors and specialists because many providers have been unwilling to contract with yet another managed care plan. For our population, changing doctors or lack of available doctors and specialists can mean dangerous interruptions in their complex treatment. Another important consideration is the CDC Plus program, the self-directed option within the waiver. Currently, there is no true equivalent under managed care. The proposed alternative offers fewer services and far less flexibility, stripping families of the control that they rely on to tailor supports, especially in more rural areas where there may be a shortage of waiver providers. Florida has an effective waiver program. It requires adequate funding, support, and responsible management, not dismantling. We request that you protect the iBudget waiver and the CDC Plus program so that it is always an available option to serve this very vulnerable, diverse, and complex population. Thank you very much.
Thank you. Next